Hi everyone, my name is Miman and I did my presentation on the dental pay system specifically for under the NHS, so not looking at privately. So first of all, if we look at the salary for dentists in training, so newly qualified dentists refer to graduates who are fully capable to be dentists, but they haven't actually started working yet. So this will be their first year working under the dental clinic, and their annual salary is around £30,000. So it's this stage. Every newly qualified graduate dentist needs to do dental foundation training for 1 year, and then after this, you can choose to enter core dental training. And this salary is between £49,000 and £61,000. And this usually lasts for like 1 to 3 years, and they work like 40 hours a week, but they can earn a 37% enhancement if they work like weekends or at night time or on holidays. And they can also receive an availability allowance if they are like on call. So like when they're called, they can come in to work. And then after core dental training, you can actually go into dental specialty training, and this is when you do 3 to 5 years of like consolidating specialty knowledge before you go into the specialty of dentistry, and their salary ranges between £61,000 and £70,000. So if you look here, after dental foundation training, which is 1 year, you can actually choose to go into work in dental practice. So dentists in practice. So actually most dentists under the NHS system are self-employed contractors, and what this means is that their salary actually varies depending on how much like work they do or like the services they provide as a dentist. And under the NHS they earn between £50,000 and £108,000. And for specialty dentists, there are actually 13 specific types of specialties of dentistry, so the salary varies for all of them. But the popular ones like orthodontics earn around £111,000, and endodontists earn between £60,000 and £96,000. And then also consultants in dental practices earn between £100,000 and £130,000. And what these people do is basically they kind of like mix dentistry and business, and they supervise the practice to give insight and advice on how to maintain and improve the practice. So then there's a recent controversy around the NHS pay system for dentists. This one is an article from The Guardian, and it's covering the new change in the dental pay system. So in 2006, the guaranteed access system was replaced with a UDA dental contract, and that stands for unit dental care. And in the guaranteed access system, dentists were paid an agreed sum that actually correlated to the amount of care that a patient needed. And the difference between this one and the new one is that in the old guaranteed access system, if you called, it would be similar to the GP system. So if you called, you'd have like a permanent dentist that you could visit, but now that's changed. And in the UDA dental contract, it stands for unit dental care, and of course refers to one course of treatment, and dentists are paid per UDA. So if you do like a checkup, that earns you 1 UDA. If you do like a filling, that earns you 3 UDAs. But the problem is that with this system, no matter how much of a specific course of treatment you do, you still earn the same amount of UDAs. So for example, if you did 1 dental filling, you still get 3 UDAs, rather than if you did 5 dental fillings, you still get 3 UDAs. And that's how dentists are paid by UDAs, so that affects how much they earn. So that means that if they take on like high risk patients, they'll actually earn less, like they'll earn the same as if they had like less of the same problems. And then furthermore, dentists receive penalties if they fail to hit targets. So there's each different course of treatment gets you different amount of UDAs, and if you don't do like all types of treatments within like a specific period of time, like a year, then you can actually get penalties. And the main cause of this, of receiving penalties, is because people don't really come in with them problems. So like, if no one really needs like a specific treatment, then you can't really do that treatment, and then you will get penalties which you have to pay a fine for. And this is what Ara Dorothy said. He graduated medicine from Imperial, and he said that the NHS system offers no rewards for prevention. So if you were to like take a high risk patient and prevent like their teeth from getting worse, or like repair the damages that has been done to it, then you wouldn't really be rewarded. Whereas if you didn't do like a specific type of treatment, then you would be punished. So there's no really reward for going up and above, but there is a punishment for like not doing everything possible. And the effect of the new NHS pay system is actually a shortage of dental care, because people are finding it really hard to get like dental checkups or like simple things, because they don't earn that much UDAs, and dentists need to like prioritize what gets them the UDAs that they need, like to cover all their checklists. And actually dentists are starting to speak up, especially on social media, and there have been like news outlets covering this. So they actually encourage like the public to start campaigns so that we can cause a change in the dental system. And yeah, that's like this. So thank you.